Right. Good afternoon, everyone. My name is Liana Willis. I'm a research assistant in the Youth Health and Development Lab here on campus, led by Dr. Aerika Loyd. And this is a project looking at the effectiveness of culturally and family-based well-being interventions on increasing well-being in African American youth. So some background, existing research shows that African American parents are less likely than white parents to seek out clinical mental health treatment for signs of mental health problems in their youth. And there's also growing evidence that family and culturally based well-being interventions can be effective at increasing well-being in Black youth. So we wanted to look at two things. Number one, what are some key components of these effective culturally based interventions? And then what are some common outcomes across them? And so for our methods, we conducted a systematic literature review to identify articles, and we reviewed those articles for relevance. We looked for keywords. They had to be evidence-based. They had to have empirical research on the effectiveness of their outcomes. They had to be for Black youth, and they had to have a cultural component. And from that literature research, we selected three programs that fit the criteria for our analysis. And so the first of these programs was called Embrace. And so this intervention, their goal was to improve coping skills, emotion regulation, emotion communication, and self-knowledge. And they used a racial socialization approach to accomplish this goal. So what that entailed was facilitated discussions between youth and their parents about racial identity, racial pride, and specifically how to cope with instances of discrimination. And they were effective at accomplishing their goal of increasing coping with those youth. And then the next program is called Strong African American Families. And so their goal was to reduce externalizing behaviors in Black youth. And they also used a racial socialization approach. So in their discussions about reducing externalizing behaviors, they included a discussion of a racial pride, how to have pride in your racial and ethnic identity, etc. And they were effective at reducing externalizing behaviors through that approach. And then our final program, Strong Start, their goal was to both increase coping behaviors and also reduce externalizing behaviors. And they used a cultural representation approach to accomplish that goal. And so what that involved was using readings featuring African American characters to teach the coping skills, how to communicate your emotions better, how to manage your anger, how to deal with conflicts with friends. So to teach those skills, they used readings that featured African American characters. And this program, they were effective at increasing coping, but they were not effective at reducing externalizing behaviors, which was interesting. So to conclude, the one interesting finding about the first program, the Embrace program, they had particularly strong improvements in coping for parents. They did have improvements for children as well, but they were particularly strong for parents. So maybe there's something key in that approach for parents or adults in particular. And then also, as I mentioned, the cultural representation approach in the third program was not effective at reducing externalizing behaviors, but the Strong African American Families racial socialization approach was effective at reducing externalizing behaviors. So maybe there's something key in that component of getting parents involved for reducing those externalizing behaviors in these programs. And then one of my recommendations for future research is looking at how we can incorporate some of these cultural basis, culturally adaptive components into clinical mental health treatment programs, because these, of course, are just general well-being interventions, but we want to see how we can improve the issue of African Americans' hesitancy to pursue clinical treatment as well. So that concludes my presentation. Here are my references, and let me know if you have any questions. Yes.
I just had a quick question on the participants who were involved in the program.
Sure.
Do you think there would be any difference in data if you had them join with a friend versus going solo? And because you did mention that parents getting involved did help with external behaviors.
Yeah.
So what do you think could be the reason? Like maybe was it because they were doing all this by themselves and maybe their friends had different ideas, and then once they were outside of the group session, they were getting those ideas fed back again, and maybe that was like just deteriorating the progress, or what do you think?
Yeah, so I think, so you're basically asking what the effectiveness of the racial socialization approach incorporating families would have been as opposed to incorporating friends?
Yeah.
Okay, sure. So I would say, because we had two programs that utilized a racial socialization approach and one that had a cultural representation approach. And I think something that's key is, for example, the cultural representation approach, it's a little less specific because it's utilizing, looking at, African American characters, but the racial socialization approach is looking at racial identity through the lens of talking to your parents and your family members. And that's a more specific experience that you can identify with more. So I think that that was one of the benefits of that approach. So when we talk about friends, I think incorporating your friends could also be more beneficial than just a general cultural representation approach because you can identify personally with your friends, particularly if they're African Americans. But I think there's a specific benefit to looking at communication between parents and families because there's a specific kind of identification that happens there in terms of youth's communication with their parents. Does that kind of answer your question?
Yeah.
Sure. Yes.
So I know in your poster you noted a little bit about the delivery of the programs and like who delivers the program.
Yes.
I was wondering if you could talk a little bit more about that because I think that's really interesting.
Sure. Yeah. Let me slide back up. Okay. Yeah. It does not say on here, but so the first program, Embrace, they had licensed clinical therapists implementing the intervention, so facilitating the discussions on racial identity. And the other two programs, they did not have clinical therapists. They had just trained staff that were identified as African American. So I thought it was interesting that the Embrace program, even though they had clinical therapists implementing their intervention, they had similar improvements to coping skills to this third program that did not utilize clinical therapists. So something in that's kind of points to maybe a potential benefit of the cultural representation or the cultural adaptation component, even in spite of not having clinical mental health professionals implementing the intervention. Of course, these are for generalized well-being interventions and not clinical treatment programs. But that is something to kind of explore further in terms of like my additional research interest in how to implement them into clinical programs, what that looks like.
What do you think an implementation of kind of reaching out into the community with these programs might be? Because at least for me, I come from a culture where it's kind of okay to say you're going to see a therapist.
Mm-hmm. Yeah, definitely. I think that was one of the study that I looked at that talked about African American families' hesitancy to pursue clinical treatment. That was one of the factors that they noted in terms of kind of like the traditional coping styles within the community. So I think that having kind of more community-based programs like this, because one of the things that we found in our research is that there are not an abundance of evidence-based programs that cater to African American youth and families. So I think increasing the number of programs like this, and not only the number of them, but kind of the presence of them in the community, I think will kind of help with that aspect because it'll be a little more normalized, specifically when we want to talk about clinical treatment programs. Yes.
These interventions, were they implemented temporarily, or are you planning on, normalizing having these interventions like consistently throughout the future in these communities?
Sure. So this Strong Start program, it was actually started as a generic intervention, and then they found in a sample that it wasn't effective on African American girls, which led them to continue on to do the cultural adaptation component. I am not sure that they're still running it culturally adapted now. This may just have been what they did for this specific trial, but the other two programs are still active outside of the research for these programs. Yes. Oh, well, thank you guys so much. Thank you.